Hi everybody, how are you doing? I'm slightly early this week, first time for everything. I hope you're all well. It's Thursday. I've been thinking it's Thursday all week for some strange reason, but it actually is Thursday today. So that means it's your regular lunchtime foray into my mind. So this week I wanted to talk a little bit about blood status, what it is. And not really necessarily that, but just to shine a bit of a light on something that people don't necessarily realise is related to endometriosis. So, in Chinese medicine, endometriosis is typical of blood stagnation and blood status, which is basically, in essence, both of those are stripped right back. It basically means that blood isn't circulating as freely as it should be doing. I've just noticed that's really annoying. I'm just going to sort this out. Just bear with me 2 seconds. So it basically means, yeah, that your blood isn't flowing as freely as it should be. Now, when blood stagnates in Chinese medicine and Eastern medicine, we also get a stagnation of energy. So it's the whole thing just gets the whole flow. You'll have heard me talk about this before, but the whole flow of chi, the whole flow of energy, the whole flow of blood, water, all the nutrients in our body just stops, and everything just becomes a little bit stagnant and static. So endometriosis is typical of this kind of condition. So with things like this, we get pain, we get inflammation, we get blood clots. You'll have heard me talk about this before, but some of the other symptoms that people don't always realise are related to endometriosis are things like pigmented skin. Now in Western medicine predominantly sees or predominantly acknowledges blood status in terms of skin impact in the legs, the lower legs especially. So things like inflammation, and then almost like a dermatological condition, some sort of eczema, a bit of bruising, dry skin, that kind of thing. In Western medicine, that tends to be seen predominantly in the lower leg when it comes to blood status. But in Chinese medicine, it can actually happen anywhere. And in terms of my clients, people who I've worked with before, that tends to be most prevalent in the face and the neck, but mainly the face, and specifically sort of cheekbone area, temple area, forehead. Now this can look like eczema, it can look like dermatitis, it can sometimes be painful to the touch, it can just look like acne, but it's predominantly dry rather than, sorry if you're eating lunch, rather than a sort of pussy, what's the word I'm looking for? Rash. It tends to be more of a dry rash. So it tends to be, like I say, that kind of eczema, dermatitis, that kind of itchy dryness. And it also can just be pigmentation. So if you're getting blotches on your skin, that's also a sign, especially if those blotches are kind of purpley in colour, or there's an element of purpley bluish kind of tint to them, then that is all very typical of that stagnation that we see with endometriosis. So a lot of people kind of just think that it's stress or that it's hormones, which a lot of the time it maybe could be, but in terms of Chinese medicine, it's all part and parcel of this stagnation. Other things to look for that are still part of this stagnation that you may not necessarily recognise, you may not necessarily even notice, but that can also be part and parcel of your endometriosis. So things like your tongue. Tongues are so important when it comes to Chinese medicine. So if you pop your tongue out, and your tongue is, again, like a purplish colour, almost like a bluey tint to it, maybe even just blotches, so even if the whole thing isn't necessarily bluish, if there's a layer of fuzz as well, that's quite a good indication that the energy, the blood in your body just needs to be moving that little bit faster, that little bit freer rather than faster, I should say. So yes, purple, elements of purple on the tongue, especially if the tongue feels slightly swollen, if there's that fuzzy, furry element to it, but sort of bluish, purplish patches or a bluish, purplish tint is a really, really good indication of this blood status. Nails, fingernails. Quite often I see people with purple tints to their nails, and again, not necessarily the whole nail, but especially at the bed of the nail or at the top of the nail. But if you see either of those places, that's a cat. She must have been there for a couple of hours. I didn't realise she was there. That kind of freaked me out a little bit. So yeah, if there's a purplish tint to your nails, either the whole nail or just part of the nail, be that the bed or the top of the nail. But again, that's symptomatic that the blood, that the chi in your body needs to be revitalized, needs to be moving, needs to be rejuvenated a little bit. Purple lips, so again, just a purpley bluey tint to your lips. That can also be an indication. Headaches, if you're getting piercing headaches, the kind of headaches that make you, I don't know, that's exactly why I squinted, I think, but the kind of headaches that make you want to squint, that kind of piercing pain, predominantly here, but it can be right around the body, right around the head, anywhere in the head. But piercing headaches, that can also be a sign, and stabbing localized pain. So exactly like we experience in endometriosis, that kind of still stabbing, piercing pain right deep in our abdomen. So if you're experiencing anything like that, it's not necessarily something else that you've got to think about. It's not necessarily something else to add to the list. It's just something to add to the list of symptoms. So when I talk about tracking everything, that's why it's so important to track things like skin condition, hair, how thick is your hair, how dry is your hair, how greasy is your hair. Track everything that you can, because that's so important when it comes to recognizing this stagnation and exactly what's going on with your endometriosis. And again, it could be hormonal. So if you don't have any of the other symptoms that are being displayed, then it could be your skin pigmentation or your skin spots could be an indication to look greater at your hormones. But again, we need to understand what's going on with your hormones. So we need to look at all the other symptoms that are going on as well. So I hope that's kind of reassuring if you're struggling with skin issues, if you're struggling with pigmentation or spots, breakouts, dry skin, anything of that ilk, any kind of eczema. I hope that that's reassuring, that it's not unusual. In fact, it's very common for this to be part and parcel of your endometriosis. And that's not to pile even more onto this endometriosis label that we've got, but actually it's a really good thing because it helps you understand your endometriosis just that little bit better, certainly from an Eastern medicine point of view. Any questions, drop me a line. That's it for today. Short and sweet. If you have, like I say, if you have any questions, drop me a line. If you have any comments, pop them below. You can also comment anonymously now as well if you wish. Have lovely weekends, whatever you're up to. Let me know how you're doing. Drop me a line to let me know how your endometriosis is feeling today. If you've got any specific questions, I'm always here. Don't forget that the first Tuesday of the month is the endometriosis clinic. So if you have any questions about anything, like I say, it doesn't even have to be endometriosis related, in terms of you could come with any symptom and ask me whether it's related to your endo, or you can ask specifically about your endometriosis. That's the first Tuesday lunchtime. Just come along. I answer questions on a first come first served basis. It's free. And there is an option to pay what you feel at the end. All of my webinars now I'm running on a pay as you feel basis. So it's free. They're all free to register. They're all free to attend. And then there'll just be a link at the end that you can pay an amount, a small amount at the end if you feel as if it's helped. The first Saturday, so next, not this coming Saturday, the Saturday after, that's my webinar weekend. So the first Saturday of every month I do the webinar, the free webinar, the pay as you feel webinar as well. So just check out my webinar channel, which I'm hoping, I'll put the link underneath this if I haven't already put it in the, I'm hoping I've put it in the group. But you can access all of my webinars now in the same place, which makes it dead easy to register. So yeah, pop along to that first Saturday of every month. Okay, I hope that this helps. Any questions, give me a shout. Have lovely weekends. And if I can help in any way, do not hesitate to get in touch. Cheers, guys. Take care.